The most fundamental aspect of medical care is physician-patient communication. However, new research portrays the shocking reality that patients commonly have difficulty understanding medical instructions from physicians. Physicians often mistakenly use medical terminology, deliver too much information at a time, and do not confirm with the patient that they understand what was just discussed. Patients commonly remember less than half of what the physician explained and are left in a state of confusion about what to do next. Low health literacy also contributes to the communication barrier between patients and physicians. According to Dr. Kripani, patients with low health literacy normally are less familiar with medical concepts and they tend to ask fewer questions. Out of embarrassment, many patients will hide their confusion. New research shows that physicians continually overestimate a patient's literacy level. Physicians rarely consider a patient's limited literacy skills and their assessment of whether patients comprehend what they need to do next. The American Medical Association Ad Hoc Committee for the Council on Scientific Affairs, the National Work Group on Literacy and Health, and the Institute of Medicine are calling for there to be greater efforts to educate health professionals regarding issues related to health literacy. Together, these organizations have developed effective strategies to teach about health literacy and clear communication that will be discussed in this speech. One way to ensure physicians understand the magnitude and importance of health literacy is to develop a workshop on health literacy. This could be in the form of a short lecture or a 90 to 120-minute workshop. While the workshop would be longer, it offers a better way to not only refresh previous knowledge on health literacy, but it also provides an opportunity for hands-on practice with recommended communication skills. If it is decided that a workshop is the best way to present the information, bringing in local patients or adult literacy students to provide a testimony of their experience with the healthcare system would provide a powerful witness for the physician to see their work from the patient's point of view. If a healthcare provider does not have the means to bring in these people, then showing selected patient witnesses from the Institute of Medicine or AMA's Health Literacy Video Archive is an extremely effective technique. Having already taught the physicians about the prevalence of the issue, the medical care experiences of patients with health literacy, and the strong correlation between literature and medical outcomes, employers should now empower their physicians by teaching them how to communicate effectively with patients. According to Dr. Weiss's article titled Communicating with Patients Who Could Not Read, published in the New England Journal of Medicine in 2006, there are 7 strategies he recommends for clear communication. Strategy 1 is to assess the patient's baseline understanding before providing extensive information. For example, if a patient was newly diagnosed with hypertension, the physician could ask what he or she knows about high blood pressure. The second strategy is to explain things clearly, using plain language. It is important to avoid medical jargon, vague terms, and different medical and lay terms. For example, instead of a physician saying angina, they should say chest pain. The third strategy is to emphasize 1 to 3 key points and repeat these points throughout the visit. The fourth strategy is to effectively encourage patients to ask questions. Physicians should use an open-ended approach. A physician should ask, "What questions do you have?" instead of, "Do you have any questions?" Strategy 5 suggests using a teach-back method to confirm patient understanding. The physician should ask the patient to repeat things back to them to ensure their understanding. The sixth strategy is to write down important instructions. This lets the patients know exactly what they should do after the visit. Dr. Weiss's final strategy suggests providing educational materials. This allows patients more time to absorb the information. The strategies suggested by Dr. Weiss should be effective with all patients, but they would be particularly beneficial when communicating with patients who have limited literacy skills. These strategies are based on clinical observations and expert opinions, but new evidence of their effectiveness emerges daily. Dr. Schlinger's study that was published on the Web of Science in 2008 said that patients who suffer from diabetes reveal that when physicians use the teach-back technique, patients ultimately have better glycemic control. Like any new communication behavior, these communication skills require practice in order to use them effectively. An employer may also want to structure small group exercises that offer a venue for residents and physicians to practice their new skills. One trainee would play the role of the physician, another would be the patient, and a third would be an observer to provide feedback. Another way to engage listeners is to show a trigger video. A trigger video consists of a short patient-physician interaction where the physician demonstrates poor communication skills. After the video, The viewers react to the film, point out specific examples that could be improved on, and finally model ways to communicate the same information more clearly. For an even more effective technique, an employer can videotape each trainee's interaction with a patient who is trained to play the role of someone with low health literacy. Having the trainee watch the video with a facilitator will provide them with an opportunity to reflect on their own communication skills, receive feedback from a staff member, and develop areas of improvement. Nearly 10 years have passed since the AMA Ad Hoc Committee on Health Literacy first stressed the importance of incorporating health literacy education into graduate medical training. While some notable progress has been made, there is still a need for greater attention on health literacy and medical education. Countless opportunities exist to educate medical students and residents about health literacy and the communication skills that are recommended for clear communication. It is strongly encouraged for clinical educators to implement health literacy workshops and for clinical faculty to model and reinforce techniques that foster clear patient communication. Providing a cure for health literacy by modeling and reinforcing techniques that foster clear patient communication will exponentially improve the patient's life, not just physically, but also mentally.